Section 13.5 is on oral contraceptives and also on natural and synthetic female sex hormones. And there's a lot of really big structures in this section, which is why I have it as a PowerPoint where the structures are already pre-built. So drawing these structures out is really tedious and not necessary for you to do. First thing that we're going to look at are estradiol and progesterone. These are the structures of two hormones. These are naturally produced female sex hormones. So us females, our bodies produce both of these hormones naturally, and they're also available by prescription as a pill or an injection or as a cream. The structure on the left-hand side, estradiol, is out of all of the estrogens in our body. We consider this to be the most significant, the most prevalent, most important of all of our estrogens. And then the structure on the right is progesterone, which similarly is the most important of all of the progestogens. And again, these are two hormones that our bodies just produce naturally. What we're going to look at next are the structures of 4 female sex hormones that are synthetic, not naturally produced. So the first one we're looking at is ethinylestradiol, which is abbreviated EE. And if you look at it, you'll see that the structure of this particular molecule looks really similar to the structure of both estradiol and progesterone. This is a synthetic estrogen, so synthetic means that it's made in a lab, it's not made in our body, and it is one of the 2 active ingredients in most of the birth control pills that are taken by women in America. If you are taking a type of birth control pill that's called a combination pill, that means the birth control pill is a combination of 2 active ingredients, and this is definitely one of them. Or most likely one of them. It works as a birth control because when our bodies have high levels of this ethinylestradiol, our bodies get tricked into thinking that they're pregnant. And so when we are pregnant, we don't try to become pregnant a second time. So if we can trick our body into thinking that it's pregnant, it's going to kind of shut off the process of starting a second pregnancy. So this is one synthetic hormone. Here's another one. This is norethindrone, and if you look at its structure, you'll see it's similar as well to the structures of all the other ones we've seen so far. This is a synthetic progesterone, and if you're taking a combination birth control pill, this norethindrone can be combined with ethinylestradiol. So this would be one possible combination, ethinylestradiol plus norethindrone. Norethindrone works differently than EE. Norethindrone's job is to thicken cervical mucus, which makes it harder for sperm to get through the cervix up into our uterus and fertilize an egg that might be there, and prevent pregnancy in that way. So if you're taking a combination birth control, your body, the pills are trying to prevent pregnancy in 2 different ways all at the same time. One, trying to keep you from ovulating so you don't get pregnant a second time. It thinks you're already pregnant. 2, making it hard for sperm to get in and actually fertilize any egg that might have been released. If you are taking the mini pill, a mini pill is a single ingredient birth control, and so it's not a combination. This is the active ingredient in a lot of the mini pills. This particular drug does not have any effect on our body's estrogen levels, so it's a good pill for women to take while they are still breastfeeding, because if you mess with a woman's estrogen levels, it can have a negative effect on their ability to produce milk. But if this is your only method of birth control, thickening cervical mucus to prevent pregnancy, it doesn't have as good of a success rate as a combination pill. So we also have a second synthetic progesterone, and this is Levonorgestrel. And again, look at the similarity of the structures of all of these. They all look very similar. So this is a synthetic progesterone. This can also be combined with ethinylestradiol. Ethinylestradiol plus levonorgestrel, that's another possibility. This also works by thickening the cervical mucus, but it does it much more significantly than norethindrone. So this is more powerful. In addition, levonorgestrel is the active ingredient in Mirena, the hormonal IUD, not the copper IUD, but the hormonal one. And in high doses, it's used as emergency contraception, which we call, in the US, we call Plan B. So if you're taking a combination pill, again, it's going to be ethinylestradiol combined with either norethindrone or levonorgestrel, and your doctor will make a decision about which combination is right for you. With levonorgestrel, our bodies have less risk of forming blood clots, which is one of the possible side effects of hormonal birth control. If you're using ethinylestradiol plus norethindrone, our body has less risk of developing depression, and there's also a lower instances of acne as a side effect. So you just kind of choose which one makes the most sense for the patient. And then one more synthetic hormone that we're going to look at is Mifepristone. This is not a birth control. This is an anti-progestogen, which means that when you take this drug, your body just stops producing progesterone. Progesterone is necessary to sustain pregnancy. So if you take a very high dose of Mifepristone, it will basically terminate your pregnancy. The RU486 drug, which is a pill abortion drug, a chemical abortion drug, does contain Mifepristone, and it works as an abortion drug by destroying the placenta during pregnancy, and if the placenta is destroyed, the pregnancy will be terminated. In some countries, not in the United States, in some countries, emergency contraception is, in fact, a low dose of Mifepristone, which is going to work as well. So if you go back, if you flip through and look at all of the structures of all of the natural and synthetic female sex hormones, you'll see that they do all contain this similar ring structure. So they all have this kind of base to them, which we're going to come back to and talk about later on in the quarter. But one thing that you'll notice, let's look at this, all of the synthetic female sex hormones have something in common that is unique, different from the natural female sex hormones. So up here at the top, here are our natural female sex hormones. And down here at the bottom, these were the 4 synthetic female sex hormones that I showed you. And all 6 of these drugs have that same ring structure to them. But if you look, you will see every synthetic female sex hormone has an alkyne in the same place, every one of them, and it is not present at all in the natural female sex hormones. And that's kind of the takeaway from all of this.